Hey everyone, guess who's flying solo tonight? It's me. Yep, those two people you see in that picture. I put them up there because I will miss them, even though I'm going to talk bad about them the whole time. But yes, I'm going to miss you, Dr. Chad Duplantis and Dr. Jennifer Bell. We're the amazing trio, but I got to fly solo tonight because these guys abandoned me. Welcome to Humpday Happy Hour with Dentists in the Know. This is your backstage pass for current trends, politics, and education in the dental world. We are live and we are over a little cocktail with my friends on my favorite glass. And we're just here to chill, relax, and talk about cool dental stuff. Tonight, I've got two amazing guests. One of them is a dental hero of mine from a while back. And the other one happens to be her son, who's a dental hero from a time present. We have Rose and John Nierman with us, but we're going to make them hold on for just a couple of minutes because guess who's going to do banter and the news and everything by himself? It's going to be me. I'm sorry you got to hear it, but that's the way it is. Anyway, when the three of us are together, we are all dentists, we are all business owners, and we are all practicing dentists. So our job is to bring all of you in the know. So with that, where I want to start is I am freshly back from Germany, Cologne, where I was at the IDS meeting. I know most of you know this already, but this is probably one of the coolest dental meetings you'll ever attend. It is not a lot of dental education. There is a lot of education on the floor, but this is the world's largest dental trade meeting where you're going to see all of the newest technologies and the coolest things that we probably won't even have in the United States. And I'm actually going to be talking to Rose and John about some of this because we will end up getting into TMD and sleep apnea and talking about hands-on experiences and just so much that applies. But some of the technologies that I saw were just out of this world. And I think the highlight for me was probably the 3D printed anatomical models. So now our 3D printing capabilities are where we can print 12 colors at a time, multiple textures. And so complete live anatomical models were being 3D printed in a reasonable amount of time. And what does that mean? That means for like hands-on experiences now, we have every different bone type and we can put it in a true anatomical model with real, or not real gingiva, but what feels like real gingiva that actually bleeds when you cut it, that you can suture with the right bone type, and that will come from any CBCT that you choose. The rest of the anatomy can be placed there as well, as far as nerves. We can place blood vessels in there. It is just unbelievable, the technology. So I think we're going to end up moving away from, using like pig jaws when we place implants and having to find, heads, which are very expensive, hard to come by. And, the experiences are just so limited because of it. So that was one of the highlights there, but all the technology just blew me away. And thanks to our good friends at Evolve and Evolution Dental Lab, I kind of tailed around with them. I had a lot of my own contacts there, people that I've worked with in the industry for a while, but I actually got to see this one more from a laboratory perspective. And what a unique experience that was. So anyway, I encourage all of you, if you get the chance, please get to an IDS meeting in Cologne. The next one will be in 2027. So I got some sad news for you. I actually have to do the news tonight. So JB, I'm going to make you so sorry that you are not here because I'm going to try and do a little news segment. And I'm trying to actually produce this whole thing at the same time. So this ought to be pretty darn interesting. All right, let's go. So our first story in the news tonight is that Jeff Horowitz is named the sexiest man alive. Can you believe it? I told you you'd be sorry, JB. When asked about their decision, the polled residents of the Shady Hills nursing home said he was the obvious choice and clearly walks without a limp. So much for my stand-up career, huh? Sorry, JB. All right, let's do some real news. Anyway, as a part of the administration's efforts to restructure federal health agencies, the Center for Disease Control and Prevention's Division of Oral Health was essentially gutted as of April 1st. This comes after the U.S. Department of Health and Human Services announced March 27th that 10,000 full-time employees are going to be laid off as part of the agency overhaul. So what does that mean? Within the agency, the CDC's Division of Oral Health typically has provided evidence-based guidance on a range of public health issues, including infection control in all of the dental practice settings, community water fluoridation, dental sealant programs, and many others. I know that there's no intention to eliminate these services, but it leaves us wondering who is going to be there to fill the void. In his formal statement, the ADA the ADA has urged President Trump and HHS Secretary Robert Kennedy Jr. to reverse the cuts, stating that oral health has to remain a national priority. Our dear friend and ADA President Dr. Brett Kessler is monitoring the situation closely, but he's expressed his disappointment in the oral health workforce reductions. Congress is preparing to challenge the reorganization of the Department of Health and Human Services, and Secretary Kennedy has been asked to testify at an April 10th hearing. And lawmakers at that time are expected to raise concerns about the scale and the legality of all of the restructuring. The ADA said they'll continue to monitor the developments and assess the implications for dental public health programs, including those related to water fluoridation, oral disease prevention. So stay tuned. And speaking of anti-fluoridation or fluoridation concerns, anti-fluoridation activists have been continuing to claim that mandated water fluoridation poses ethical and safety concerns. And many states are considering legislation now that are going to ban adding fluoride to public water systems. In the current heated political environment, the fluoride debate has been front and center, with anti-fluoride activism on the rise, though most dentists support it as a safe and effective way to prevent tooth decay. According to the ADA, 82% of polled dentists expressed strong support for water fluoridation, 10% saying that they somewhat support the practice, and only 5% said that they somewhat oppose or strongly oppose the practice. Although organizations like the ADA and AGD staunchly support fluoridation at optimal levels, and most states embrace the practice, others are considering removing fluoridation mandates or banning it altogether. It's been really interesting watching how the states have been reacting, with a lot of legislation on the table right now. Without getting too into the weeds, we just want to update you on where the states are leaning on this issue. To date, only one state has passed a bill completely prohibiting community water fluoridation, and that one is, believe it or not, Utah. And that's where JB is right now. I won't bug her to get local commentary, but it is going to be very interesting to see the results of that decision, say in about 10 years or so, when some of the children will be coming to an age where caries is typically a large concern. Other states that have proposed bans awaiting a vote on community water fluoridation are Tennessee, Louisiana, and Florida. Meanwhile, a few states have proposed bills that would allow the practice to be optional, allowing local governments to decide, which to me at least is worth discussing. Those states are Nebraska, Kentucky, and Arkansas. On the other side of the coin, bans on water fluoridation have either failed or been tabled indefinitely. These states are New Hampshire, North Dakota, and Montana. And then there are only two states, New Jersey and Connecticut, that currently have bills proposed that will ensure continuation of community fluoridation. This is a really hot topic right now, and I'm sure we're going to see more states chime in shortly, but we'll do our best to keep you in the know. And finally, and I know you're glad to hear finally, I don't usually do this much reading, by the way. I'm kind of an off the hip kind of guy. But when you're filling in for a JB, I mean, I mean, it's got to be good. So, I had to put my words into writing. Anyway, I'm sure you've all heard of the tragic death of a 9-year-old girl in San Diego who just hours after a dental procedure that involved general anesthesia passed away. We don't have all the details yet, but according to the medical examiner, the child was moved to a recovery room after the surgery and then discharged. It said that the child fell asleep on the ride home and continued to sleep when she arrived. The next time the family checked on her in her room, she was unresponsive and she was ultimately pronounced dead after resuscitation efforts failed. According to the dentist, following the procedure, she was discharged in stable condition, awake with stable vital signs and protective reflexes intact. She was discharged into her mother's care and followed all standard post-anesthesia protocols. While the official cause and manner of death are still pending, that hasn't stopped the media from amplifying this tragedy, creating yet maybe another black eye for dentistry. The dentist in question is a dental anesthesiologist. He's a diplomat of the National Dental Board of Anesthesia and a fellow of the American Dental Society of Anesthesiology. So he's certainly well credentialed. So what went wrong here? And what can we learn from this? Obviously, we need to keep up with this whole topic, as many states have heightened regulation on dentists providing sedation and general anesthesia. The real takeaway for right now is that we can never be too cavalier with regard to sedation, especially when it comes to children. Even when everything is done correctly, things can happen. We truly, all of us here, wish the grieving family our deepest condolences, and hopefully the profession will learn something from this terrible tragedy. And certainly JB, Chad, and I will try to keep you all abreast of what's going on with that. But we'll all be very interested to see what happens. So with that, that is the news. And with that, I am going to move to bringing on our wonderful guests, maybe even a little early, right at 1:15. So let's do it. What do you say? I'm going to go ahead. And again, I'm producing, reading, and running the whole show tonight. So this is pretty fun for me. Here we go. I'm actually going to drop my friends down here. And I am going to bring up two very important people from the dental world. With me to my left is John Nierman, and below me is Rose Nierman. And as I said, these are two very influential people in the world. First of all, hi guys.
Hi. You did a
Cheers.
great job. You did a really great job multitasking.
Yeah. Well, that was mind blown. There isn't enough ADD medication on the planet for me to handle that. But cheers. Y'all got something with you?
Cheers.
Yeah. Okay. Great to see you.
Cheers, awesome. Everybody.
All right. Let me do an official introduction, and then I want to tell them a little bit of my personal experience with you. And then let's just get into some chat, because that's as much reading as I ever like to do. So anyway, let me introduce you first to Rose Nierman, who I've known of for a long time. I started very early orthodontic and TMD training in the early 90s. I think I first heard of her at some orthodontic and TMJ seminars in the Midwest with Dr. John Witzig. And she was truly a pioneer in beginning to talk to dentists about medical billing. And that's really what she founded Nierman Practice Management are. So, Nierman Practice Management from. Rose Nierman is the founder and CEO, and she is a true icon in the medical billing industry, particularly for dentists. She pioneered the first medical billing manuals, training programs, and software solutions, transforming how dentists navigate medical insurance reimbursement. With over 3 decades of innovation, Rose has shaped the industry and empowered thousands of dental professionals to increase case acceptance and differentiate their practice by streamlining the medical billing process. And I'm actually going to tell you how they help streamline the medical billing process in my own practice today as well. John Nierman, her son, is the president of Nierman Practice Management. And he spent over, even though he doesn't look old enough to have done this, you don't either, Rose, by the way. God, I'm going to get myself in trouble tonight. John has spent 15 plus years advancing dental sleep medicine, TMD, and medical billing. Where John has really made a huge impact is in all the programs, hosting over 10,000 hours of incredible CE programs across the United States, Canada, and Europe. And he was instrumental in the development of their software, Dental Writer Plus, which is an industry-leading software for streamlining medical billing, but even more importantly, the practice management for TMD and sleep apnea practices, which have really struggled, believe me when I say this, which have really struggled to find good software to oversee that type of practice. So he is a Georgia Tech graduate. He's also an avid pianist, which I got to see firsthand. I don't remember what piano bar it was, and I think it was your birthday, John. You took over the piano at one of those dueling piano bars, and extremely talented. This I did not know about you. You're a Brazilian Jiu-Jitsu brown belt. So I won't F with you, okay?
That's right. That's right.
All right. How was that for intros, guys?
That's very nice. Thank you.
All right. I am so happy to be past all the stuff I need to read. So let's begin first. Rose, I would like for you to talk about the early days of medical billing. What need did you see? How did you start in this career? And then as you were attending these courses, what need did you see in the world of dentistry and orthodontics and TMD? And then how did you first address it? How did you get started?
Well, great question. I actually worked in a dental office in South Florida. I'm from the Midwest. I'm from Indiana. But my husband and I had moved to Florida. I worked for a dentist who was doing a lot of TMJ treatment and functional orthodontics as well. So we started looking at our patients who had TMJ disorder, and we're like, this is not about the teeth. This patient's in pain, and we're treating the joints and the muscles and even tinnitus sometimes. So I learned how to do medical billing. I took a course just so that we can help our own patients. And from that, my dentist was one of the founding members of the AACP, American Academy of Craniofacial Pain. And so all his friends started calling me, and I'm like, oh, okay, this is something that, I can do as well. So I worked in the dental office and helped dentists bill medical for starters. And then it became full-time. So in how it evolved is, first I wrote a 300-page manual called The Complete TMJ Manager, everything about medical billing for TMJ. Then sleep came around, of course, so we have the sleep manuals. And I hate to, throw too many dates out there because it makes me feel old, but in the late 80s or about 1990, I had hired a programmer to do a software. And it was so far back enough that was DOS. But it was a great program. It really was a great program.
DOS programs never broke down, though.
No.
I mean, they may have had some shortcomings, but they were stable, right?
Zero support.
Yeah.
And so that's how I got started. It's just I've spent my entire adult life working with the dentist and loving it. So
and then how did Nierman Practice Management grow from that?
From the software?
Yes.
Oh, that made a huge difference.
Yeah.
Prior to that, there was no way they could. There weren't a lot of software programs out then in those days. There was really no way they could bill, except they did accept hand claims. So a lot of people were doing claims by hand. And it just took the company to a new level. My dentist would be calling and just thanking me, and how not only did it save them from all that administrative work, but it helped to grow that part of their practice, whether it be TMD or later on sleep. And so, just made a huge difference for the dentists that we work with.
Yeah. And it made a large impact even in the sleep world almost right away when it came out.
Absolutely.
There was truly a need for a practice management program that was really geared to handle some of the medical concerns associated with sleep apnea and TMD concerns. And really none of the dental softwares were able to address that in any good way. So where does John fit into this picture? Tell us, Rose, how and when you decided to bring good old John into the fold.
Well, he's kind of been involved in the company most of his life. When he was 5, we used to play the sticker game where he'd put stamps on envelopes.
Slave labor, I like it.
Yeah. But that aside, after he graduated from college, he said, I really just want to, come and work for the company. And I was surprised. It's not anything we'd really talked about. So he's worked really hard. And he's taken Dental Writer, which some of our doctors still just love the desktop program. They don't want to change, which is fine. But when he took that to the cloud and started adding all of these new, features, and he's going to be adding some add-ons as well, that made a huge difference. That was another point where we just saw a big difference in how much we could help dentists bill medical.
Yeah. So, John, when you came in to, really in an official capacity to Nierman Practice Management, where did you see it, and where did you see it going to? Because, I mean, I've watched this evolve over a while, and really where you guys are now is you are truly leaders in the world of sleep apnea, TMJ, craniofacial pain education. I mean, true leaders. When I look at many of the instructors that are working with you, the Gelbs, the Patels, just the list of people that are lecturing for you. You've really got a first class group. You're not really about sales or anything in your presentations. They are, such hardcore science. But, where I saw this evolve, John, I'd love for you to talk about that from your perspective, from when you came in, what you thought. I think I saw a kitty cat.
Yeah, she tried to sneak into the screen.
Talk about that from your perspective, John.
Yeah, absolutely. I'd love to chat about that. So when I started full time, it was around 2010, late 2010, and it was, the cool thing, and this was really the reason why I decided to come on board full time. Was because I absolutely loved what my mom was doing, and I gained a different respect for it after seeing over the years and years how hard she worked, and kind of the evolution from when I was a kid to then, around that time, about 2010. And I said, this is a great opportunity. What a legacy that she's already created here, and I'd love to carry that on. So I joined, and at that time, sorry, I don't know if there's a little.
Yeah, someone's got a little bit of feedback there.
Okay. Maybe it's me or.
No.
Okay.
You sound better now. It sounds good.
Is that better?
Mm-hmm.
Okay.
I think it was. Okay, good.
Yeah. So, so when I decided to join, the kind of state of the company at the time, what's really cool is that, we, even at that time, we were already kind of at the top of the field because of what Rose, she started. She created the first, manual software, as you were talking about. But it was really her core values that I think what led to the growth of the company. And then when I started, I saw these core values, and I kind of bottled them up because it wasn't something that was on the wall, but it was something that was always kind of just conveyed and in the background, but it wasn't really spoken about as core values at the time. But the biggest thing, and this was spoken about, was service and the level of support and service that Rose and the company provided and was known for. And that was her secret to success. So, even in 2010 and 10 years before that, that was always kind of the key driver of the company and the success of our clients and our dentists. And I'll never forget, Rose would say, even though we provide software, we're not a software company. We're a service company. We're a support company, because that's what these dental practices need when they want to implement medical billing and TMD or sleep. It's so different than what they're trained on doing. They really need that service. And so that was something that was already existent, as well as our other core values of innovation and problem solving and passion and enthusiasm. And so, I took that and kind of ran with it.
That's absolutely great. But what I wonder is, at what point did you see the need to expand your education opportunities? Because Rose, I know you remember these days, because we both lived through this, where it was pretty tough to get people to come into a room to learn about sleep or TMD, right? Like, nobody cared, right? And it was a long time. And then all of a sudden things started to transition where, okay, now we think we need to learn about sleep. And then all the people who got into learning about sleep started saying, oh, wait a minute, there's a joint there that we need to be aware of, and things can go wrong with it. And by the way, a lot of the people who have sleep problems already have a problem with the jaw joint as well. So maybe we need to learn about that as well. So at what point did you realize that there was a void in the dental education side of things that you thought, hey, we'd be in a good position to fill this?
Well, I've always given seminars from day one. I would fly to a city, we'd advertise it. That's where John put the stamps on the envelopes. And I would show up for 5 people, but it was fun. I actually liked the small groups. And, it just kept growing and growing, where I'd have a minimum of 15, and it grew from there. So we've always been giving the medical billing in dentistry courses from day one. When John came along, he took it to a whole level where we have dentists, clinicians give courses on not just we do the medical billing, but the treatment of TMD and sleep.
Yeah. And John, so when you started doing that, how do you approach that? How do you say, okay, there's all these dentists that really need high quality education? What's the first step that you take? Because what you've put together is something pretty incredible now. You have a sleep residency, mini residency coming up. You do incredible myofascial pain courses. You've put together really almost an entire curriculum at this point to help dentists learn these disciplines. So, how do you begin an undertaking like that?
Yeah, for us, the education is a really key part of what we do. We feel it's all connected with the systems and the billing services and then the education. So that was a really important piece. And when I really started to focus on that wing of our company, what we really wanted to do was provide a pathway, because what we saw in the industry, especially for sleep dentists, was there's just this, a 2-day course, an intro course, and then from there, they're kind of left to just figure things out. And there wasn't really anywhere else for them to go after that 2-day course. They just have to take another intro 2-day course. So then they're taking all these different 2-day courses, but there wasn't anything that was really going deeper than that. And because of our origins with TMD, we worked with a lot of amazing TMD clients and dentist clients of ours that were also speakers. And so we connected with them specifically, like Dr. Mayur Patel. This was about 10 years ago, where we wanted him to be a part of that pathway for us to start transitioning, helping dentists transition from just the dental sleep education onto the TMD and oral facial pain side, because we know how interconnected that is, and how many sleep patients also present with TMD and oral facial pain and vice versa, and how important it is to be a well-rounded sleep dentist to know that side of things too. So that's where it all really started. And then from there, just giving different specialty sleep courses, because we were looking at where there was a need and where there was kind of a gap in that education, and that's how we built the CE programs.
Yeah. So you brought up a really good point that the way that a lot of dentists have gotten into sleep is typically through, a 2-day introduction course, and they get all pumped up and people show them, oh, here's how much money you're going to make, and you're going to be able to bill medical, and here's all the great stuff about treating sleep apnea. And then they get into the real world and they realize that medical billing is not that easy. And, there are a lot of companies that kind of jump in and partner and say, oh, we'll take it off your hands. We'll just charge you a percentage and you won't have to worry about a thing. And I've seen a lot of those companies come, and I've seen a lot of those companies go. And, I think that it's so important that when you get into this, and I'm speaking from experience now, because I've done this from every side. When I started, it was slow enough that we learned medical billing and we started doing it by ourselves in our practice, very slowly, with handwritten claims, and we took the courses. And I had one person in my office that was dedicated to doing medical claims, although I almost lost her because she was a traditional dental receptionist, and then I threw medical on her. And all of a sudden, and I'm thinking, okay, well, this isn't that much extra, I'm not doing that much of it yet. But then you realize how much time there is spent on the telephone just trying to get pre-authorizations and trying to verify benefits. And now you're taking someone who's so valuable for your dental practice.
Absolutely.
and taking their time away to make them sit on hold with an insurance company, and the frustration. So I almost lost my receptionist at the time because I did that. So that was first lesson. Other lesson was, okay, I'm going to take some of this responsibility away, and I'm going to find a company that doesn't charge too much, and says that they'll just let us know whenever they need something. And I'm just going to say that didn't work out so well either, because there has to be an open way for that line of communication to happen. And so full circle, I've probably been through 4 softwares right now, trying to work the sleep and TMJ side of the practice. I've been through multiple methodologies of trying to bill, and where I landed was where I should have been in the first place. It's okay. Chad brings his dogs on all the time.
Okay.
Yeah, we all love animals, so no worries there. But anyway, where I should have been for a long time, and where I finally landed was with y'all. I saw a practice management software that now a lot of that communication that was having to be over the phone and between the office and the medical billing company was all built right now into this software that most of that information your billing team already has. And so if I could tell everyone out there how much time, and that's the most valuable thing we have in a dental office is time, how much time this has saved my team, and how much stress this has taken away. And openly, we are still in the early stages of this, and it's already done that. So where did you see the pain points in medical insurance billing for dentists, and how did you decide, the best way to address some of those pain points, Rose?
Well, we found that there is a learning curve. When I first started, I would train dental practices in how to do it in-house. And we worked with hundreds of people who did that successfully. But again, you had to have the right person. If you have a medical person that doesn't have any dental experience, that can be kind of hard, and vice versa. So we still have quite a few practices that bill themselves through Dental Rater because it prints a claim form, it tracks everything. It can be used as a standalone for a sleep apnea / TMJ practice. But then I would say, what percentage, John, would you say that use the medical billing service? Maybe like 80%, and the other 20% bill on their own?
I'd say over 80% now.
Yeah.
Mm-hmm.
So there's almost all insurance companies have benefits for sleep apnea appliances. They just have it. On TMD, you were talking about the different state mandates. There's about, I think, 38 mandates now that TMJ has to be covered under medical as opposed to dental. So that's, I think, the best kept secret out there.
Yeah.
The TMD. So it can be kind of hard to do TMD because the codes are kind of kept a secret too. There's no real specific code, but we have a lot of success with the codes that the insurance does accept. So I just think even if you're using a medical billing service, we find educating the team is still so important, because the more they know, the more successful your office will be. So we still do lots of webinars on it. I did a Q&A session at 1:00 today. That was a lot of fun. It just, holding people's hands and then being there for them. We have a great team. I think when we were at the meeting recently, you met some of our team. I think you'd
great team. Yeah.
Before, and we just really have a good team.
If I could add to that, I would say, and this, I'm going to steal this from Rose because she has a lot of mottos, but you've heard of location, location, location. When it comes to medical billing, it's documentation, documentation, documentation. And so that's really what we did with the systems, was to streamline the documentation that you need. That's part of the insurance policy criteria. And so setting up a repeatable system where you're checking off all the right boxes, making sure you're getting that information up front. That's another motto. It's what you do up front that counts and what makes the difference. So those are kind of the two things that Dental Writer Plus does. And that's what Rose figured out early on that was going to save so much time and headaches, is just having a repeatable system to generate the documentation that you needed.
Yeah. And and tell me if you would agree with this, John, because it's interesting to hear that 80% are using the medical billing service in conjunction with Dental Writer Plus. To me, the biggest pain points in sleep dentistry, the reason that so many dentists jump in and then jump out is, one, medical insurance billing, and then two, the complications that they were just not told about or right. Didn't fully understand how to treat. So obviously you guys are really addressing both of those, but to the point of the 80%, what people don't realize is that even if you train your team to do it well, you've got one person that may be able to do all the medical billing and everything, but you've got to have somebody chasing down documentation from other physicians, I mean, it's such, I don't
Yeah.
even know how to describe it when you realize how many people it truly takes to run a medical billing team, because one person, it really is a job that one person can't do, because if they're on the phone the whole time, waiting on the pre-auths and the benefits checks, then they don't have time to do all of the other work,
Right.
the actual work of billing and making sure that the documentation is correct. So
Yeah.
that's
And the other thing that's happened is with the insurance companies themselves, the wait times have gotten longer. So that's why also it used to be a little simpler for us to teach practices to do it in-house, and they wouldn't need to bring on anyone else. But now, like you're saying, that team member is probably, their time is probably more valuable than being on hold. And that's what's happening now, where there's a lot longer hold times than there used to be.
Yeah. So I can understand why 80% are doing that, and quite frankly, it wouldn't surprise me if that percentage goes up for you. But the other side of that was the other reason that so many people get out of it is not really understanding the side effects and the joint implications and things like that, the occlusal changes and all of those other things that are truly a part of sleep medicine and sleep dentistry. And so now through your education, you guys are also addressing that piece of it. And I think that has a lot to do with the success of what you're doing, is that truly you are reaching the two largest pain points in the profession.
Mm-hmm.
Yeah. Yep. Absolutely. We've been around for a long time. And so those are really, two of the biggest pain points that we did see. And we wanted to have a solution for that, because we want dentists to be successful in this, and dental team members and practices, because it is such a rewarding field. And, it's frustrating when those things that can be overcome are the reasons why a dentist stops doing sleep or TMD.
Yeah, 100%. So what do you see coming up for Nierman Practice Management and Dental Writer Plus? What's coming down the pike for you guys?
Yeah, well, Dental Writer Plus is always evolving. And so it's very exciting. We develop very quickly. We have a great development team. And so we're currently working on just more features and integrations right now to get it to a true kind of standalone program for practices that want to completely, kind of separate their sleep and TMD practice. They don't have to have a sleep only practice, but most practices, they want to have a separate, separate ledger, separate appointment book. And so it's gotten to that point now. And then we're adding just a couple more features where it's a true standalone program. You can run an entire practice off of Dental Writer Plus for your sleep, TMD, or other medically necessary services, orthodontics, oral surgeries. We have modules for that too, for the documentation and letter, narrative reports, letter writing, patient tracking, things like that. So, yeah. And then the other side of Dental Writer Plus is that medical billing service integration. So we're continuing to develop on that side as well. And that's, what you were saying earlier, it's having it all in one place. You have your documentation and the medical billing requests and the claims and the tickets, and having that transparency and that efficiency there is really key for streamlined, cases there. So we're continuing to work there and just make it more efficient and more smooth.
Yeah, one of the things you kind of breezed over, which is probably my favorite feature of Dental Writer Plus, is how easy it is to get letters to my referring physicians and dentists, and how beautifully they are put together if you just go through the exam the right way and document what you're doing. All you got to do is fill in the blanks. and the letters are beautifully written and with so little effort. And that has been, truly a struggle. What most dentists also don't get when they get into the sleep apnea world is, guess what? You got to communicate like a physician now. That means you need to be talking to their PCP. You need to be talking to their neurologist. You need to be talking to their pulmonologist. You also need to be talking to their general dentist if they're not coming to you for general dentistry, which is the case for me very often. So to be able to put letters together that easily and communications and reports together that easily, I think that's one of the great beauties. And then to be able to electronically send those right from there, it's been kind of mind blowing for me. And I'm like, what the hell have I been doing? Yeah.
Yeah.
So, and that is not me blowing smoke. You guys have not sponsored this show. Like, that's not, like,
No.
that is just me saying thank you for putting together what I think is really the just an incredible piece of the puzzle that has needed to be there for a long time.
Yeah, dental sleep medicine, there's so much about it is about collaboration. And you really can't practice on an island. You can't practice isolated. And the practitioners that do collaborate and they send those letters out, and they're even, calling and knocking on doors and making that effort. They're keeping their name in front of the medical community, in front of the other providers. Those are the ones that end up doing, 10, 20 cases a month,
Right.
because of all the referral building that they end up doing. And so it's so important. And that's a big part of the education too, is just helping our practices get into that medical model with the communication and the narrative reports.
Yeah, and that's a good point. A lot of dentists just struggle with making those relationships with physicians. And they call and they don't, the physician doesn't meet them for lunch. But what Dental Writer does is you can send, let's say it's a sleep questionnaire or a TMJ questionnaire. You send that to the patient and they register themselves and fill out the questionnaire and their chief complaints, their medical history, and all the symptoms that they're having. Then when the dentist does the exam, as you mentioned, you'll just plug in the exam findings and it generates a narrative report of medical necessity. Now, the reason I bring this up is because you're going to need that to get paid, because it's got a lot of information in it that the insurance company wants to see. But what a lot of people don't realize is what you said is it's so big that you take that report and don't just send it to a referring doctor if there is one, but the patient might have a PCP or a neurologist or an ENT. And we gather all of those doctors on the questionnaire. And all of the dentists I know that have been successful have used the system where they're sending reports out to the patient's other healthcare providers, and where the patient signs, that they approve. So I think, that's a great practice builder, maybe one of the best that I've seen, because I even have a cute story where my brother's he's a physician in the Tampa area. And he called me one day and he said, my patients are always asking who to go to for sleep. And he knows what I do. And he said, I got this great report from a doctor. He's just down the street from me. And is this the guru in this area? Because I've never had a dentist send me a report like this that was so impressive. The medical diagnosis codes were even in it. And I said, yes, that's the one. I know that doctor. Turns out he had Dental Writer.
Yeah.
But that's how powerful it is. And then I got to call my doctor and say, hey, my brother's going to be referring you patients. So it's very, very powerful.
Well, you absolutely hit the nail on the head, because that's what so many dentists will always ask is, I'm knocking on doors, and I'm trying to make lunch dates with all these people. And I'm like, don't force it. Do the work, see your patients, just what you said. gather all the information, gather all of their healthcare providers, and then just start following up with them. Guess what? When enough pieces of paper that are well written land on their desk, and someone comes in and they're intolerant to CPAP, they're like, oh, you know what? I've been getting a lot of really nice reports from Dr. Horowitz. You know what? He's the guy I think you should see. And so you totally hit the nail on the head. So by addressing that in the software and making that such an easy part, I really think that's where you put yourself ahead of the competition.
Thank you.
Yeah.
It's so important.
Oh, who do you have there, John?
Oh, yeah, this is Gracie. Yeah.
Oh, I should.
She wanted to say hi too.
Now I feel bad that I put knocked her out.
Well, so tonight we're actually dog sitting two dogs. We have our dog, a black lab Maryland, and then we're dog sitting for my son, who is at a bachelor party actually in your area. And he has a dachshund. Yeah. And then we have my sister-in-law's dog, who is a terrier dachshund mix, and that one is just wild. And also my son's fiance, she has a cat, and we are also watching the cat as well.
My goodness.
Yeah.
Yeah,
it's actually a farm. And if you don't know this about me, my oldest son, who's an artist, he actually brought a pot-bellied pig home from art school when he was at Savannah College of Art and Design.
Welcome to the home.
It was a mini pot-bellied pig. Most of the listeners already know this, and ended up growing to 350 pounds, and that animal still lives in our backyard.
Oh
wow.
350. This is
350 pounds. Oh, look at you.
Yeah, Cece.
This is our chief marketing officer at Nierman Practice Management, Cece.
Marketing officer?
Yeah. Chief marketing officer.
Yeah. And our motto is to get your ducks in a row. So if you look at her harness.
Yeah, I can see the harness.
The little duck harness.
Yeah, with our colors. Colors.
Well, guys, any courses or anything coming up that you want to talk about?
Yeah, we do have some courses coming up starting at the end of this month, April 25th, 26th. We have our session 1 of our dental sleep medicine mini residency. This is a 2-session program. And so session 2 is June, I think 6th and 7th.
6th and 7th.
That first weekend of June. And so, those are the 2 sessions, April 25th, 26th, June 6th and 7th. We keep these to really small class sizes. It's really nice, about 20 to 23 dentists. And then next door on the April date, we have our medical billing and dentistry course.
Awesome.
So
I was going to ask about that next.
We do those side by side. That way, you can bring the dentist and the clinical team on one side, bring the front office and the billing team on the other side, and come back and get all the key educational pieces down in one weekend, and then you come back for the second weekend, so you have that continuum, which is really nice. And for session 2, that June 6th and 7th weekend next door, we're going to do a sleep coordinator breakout. So we really recommend having a team member in the office that's going to be accountable for the sleep side as you start implementing sleep. And so we call that, a sleep coordinator. And so we're going to do a whole training breakout for that team member role during the residency.
Yeah. And I think you guys have been kind enough to offer everyone in the Dinks world a dinky deal. And we'll be posting that in the upcoming days. I just do not have the bandwidth to have that posted tonight while I'm trying to produce this show and talk and do the news. But anyway, our friends John and Rose have offered all the Dinks a very special deal for any of the Nierman practice management services or courses, and we'll be posting that in the next couple of days. So guys, thank you so much. It's been such a blast and so great to see you both.
Thank you so much. It's so great to see you again.
Thank you,
Yeah.
Jeff. This has been an absolute pleasure. Thank you so much for having us on, and we had a great time too.
And you know what? I was getting tired of Chad and JB's voices anyway. So this has been great. It's been nice having you all. Honestly, I'm sorry you didn't get to chat with them because these are two of my best friends in the world.
Yeah.
And when you get to know them real well, you can see why. But you know, I think all of us have that in common, that we just like hanging around with people we like, and and collaborating with that people that are trying to do the right thing and are just good people. So
yeah, absolutely.
All right, guys.
Exactly.
Well, what a pleasure it's been. And with that, we're gonna sign off. Actually, on time, which we never do. It's 9:26. We usually run a minute or two over. So from all of us at Dinks, Chad, we miss you. JB, we miss you. But I'm glad I got Rose and John to myself tonight. And JB, I'm sorry if everybody liked me better on the news. I know that didn't happen. So you have job security after tonight. And anyway, we wish you all a good night. Thanks for tuning in to Dentists in the Know. And we will see you next time around. Have a good night, everyone.
Right.
Thanks again.
Bye,
Have a great night.